So, welcome to the show, Charlene. I'm so glad to have you. I've had so many questions. People reach out to me all the time about hair loss, and I've been wanting to cover this topic of hair loss. Such a broad topic. Entire books are written by it, about hair loss. And, you being on Instagram, the derm hair doc, I wanted to reach out to you and have you cover as much as we possibly can about hair. So as we jump in here, what are you seeing a lot of nowadays?
Well, first of all, Jen, I want to say thank you so much for having me and for inviting me. It's a pleasure to do this and to work with you. So thanks a lot. So what have we heard a lot of? Well, we know we're in the middle of this pandemic for 2 years now. Who would have thought? 2 whole years.
Can you believe
And
it? Ugh.
I can't. I'm so over it now. But the truth is, with all the mental health concerns that COVID has caused and all the stress, that we are seeing a lot of hair loss due to stress from COVID or from actually having gotten COVID and patients losing their hair afterwards. So we get a lot of that. We also get a lot of traction alopecia from pulling. A lot of people are doing protective hairstyles, especially women of color, when they're doing the protective hairstyles to make the hairstyle last longer, to protect the hair, braids, twists, weaves. There's a lot of pulling.
Okay,
There's a lot
so
of pulling. Yeah.
yeah, can you just explain? Let's just jump into traction
Okay.
alopecia first. So when we use
Okay.
the word, just for the listeners, when we use the word alopecia, because we're both dermatologists, it just means hair loss. I always
Yes.
try to tell my patients that we speak in Latin, so we sound smart, basically. But
We
hair
are
loss,
smart.
exactly, but we have to speak our little language. So traction alopecia, what do you mean by, explain for the listeners who, how traction alopecia happens and what makes people susceptible to it, and then what the protective styles are that you were talking about.
Okay, so traction alopecia, basically, if you think of traction, you think of pulling, like a tractor truck or something like that. You think of pulling. Alopecia, and I so agree with you 200%, Jen. It just means hair loss. It is not a diagnosis. I get a lot of patients come and say, I was told I had alopecia. I go, that's nice. Now let's see what kind of hair loss you have. So alopecia is just the diagnosis, and it's the word that precedes the alopecia that tells us what kind of hair loss that you have. Because so traction alopecia is hair loss from pulling. And how that occurs is it could be from a tight ponytail. Like, let's say you had a tight ponytail or a tight bun. It's pulling around the entire, hairline, front hairline, the back, the sides, and it's pulling and pulling. And if you keep doing that, well, you know what? You're going to get inflammation. You're going to get bumps, and it could become permanent. So that's my concern with traction alopecia. If we stop the behavior of pulling or tension hairstyles, then we're at less risk of it becoming permanent because of scarring. So I see it a lot with the protective hairdos. Like right now, okay, right here, I have what we call bomb twists. So they're braided, and then in the end, the hair is allowed to be curly and twisted. And, this is synthetic hair. My hair is here. But getting the stylist to understand not to pull my hair, I felt like a conductor of an orchestra, because I had like three girls braiding my hair at the same time. And I was like, you take it here. Oh, this one's okay. Okay, braid like this. Because my concern is that, they will pull my hair, and then it takes another like 18 months for it to grow back. And I know from experience, I have experienced traction alopecia. It's not fun. I've injected my own scalp with Kenalog, and I posted it on the Derm Hair Doc just to let patients know, hey, if you need scalp injections, it's okay. It's not that painful. But then there are twists, and then there are styles that we think are protective locks. Someone may get dreadlocks, and they're beautiful, and I see it a lot in men, but the weight of the lock is also
Oh.
providing tension, or the locks themselves are not tight, but it's the style that we pin it in or we twist it in that now creates tension. And that's a concern, because I see men getting a lot of traction alopecia. We see it up here and we think it's male pattern hair loss. I'll do a biopsy and it says traction. I'm like, really? And so I find traction alopecia in the most unlikely places. I think of gymnasts. Gymnasts have the tightest little ponytails. Ballerinas in those tight buns. So it's like now no one is really protected from traction alopecia because it's the pulling. So I always say, hey, a little less tension, maybe you'll have to get your hair done more frequently, but guess what? You'll have hair to get done more frequently. Whereas if you're pulling, you'll have no hair soon, right? And another thing about traction alopecia, sometimes I notice when people have long hair and they're sitting back, they're sitting on their hair or they're, the chair between their back and the chair, that's tension as well. And we don't notice it. It's pulling on the hair. And I'm like, hey, be careful. Or even the scarves that we use to tie our hair at night. I have to wear a hair scarf because I don't want to get product on my face and get pimples. I know that because acne. Hey, so scarf, I have to be careful that it's not pulling hairs on the, the edges or my hairline, or that creates traction alopecia. And another thing, I love edge steamers. So I also love my patients every day. If you're going to get a hairstyle, right? You're gonna get one of these, you're gonna get braids.
Hold on, Charlene, you're cutting out a little bit with your mic.
Sorry.
Oh, there we go. There we go. Yeah, just hold the mic in place. So what was the last point that you were bringing up?
So I tell a lot of patients if they're going to get like braids or twists or weaves or anything like that, because weaves can be either glued or bonded, which I absolutely despise because sometimes
they can be braided in. Can't they be braided in? Okay.
Yeah, they can be braided in. And there we go. You can get traction alopecia from the braids. And because it's braided in a circular motion, right? And then we actually have a curved and sometimes straight needle to sew the extensions onto the braided hair. And sometimes the braids themselves aren't tight, but the tension at which the hair is sewn in is so tight. I've had that myself where she was like, I didn't braid your hair tight, doc. It's okay. It's not braided that tightly. I said, okay, great. But as she's sewing, she's going like this. I'm like, okay, now that's tight. Okay. And I go home and my head hurts. That is not good. I tell everyone, if you've gotten your hair done and you have a headache and you have to take a painkiller, that is way too tight. Those are the patients when I see them in the office, I'm like, oh my God, you just got your hair done. You're going to need a little, steroid, liquid or foam or something to get in there so you don't get those bumps. Or sometimes I already see the bumps and I'm like, let's calm this down before it gets worse. That might be at an acne visit and it's a, by the way, your hair is too tight. Now the other thing is with the weaves and being braided in, I always say, you know what? Don't braid your hairline. Leave your edges out. For the weave or for the braids or anything, leave your edges out and use an edge tamer, or we call them edge controller, edge tamer, so that you will still have hair and you use the edge tamer to tame the edges. That's kind of like what I did here. I did not allow them to braid from here. I'm like, nope, been there, done that. You're not doing that to me again. And my patients are going to look at me and say, doc, isn't that what you told us not to do? And so I said, we're going to leave these out. And I got a little edge tamer to kind of like make my edges behave.
Oh, okay. I've never heard of edge tamer before. So what you're saying is,
love it.
Okay, I'm learning so much. This is great. I feel like pretty simple with just blow drying my hair straight a couple times a week.
It looks lovely. It's bouncy.
So, so what I'm hearing from you is this traction alopecia. It sounds to be way more common than I even was aware of. Yes. And I know that I've experienced this myself with a tight ponytail when I go to the gym, and even just having breakage in the back of my hair from pulling up so often, or lying against your hair, or the way that, it sounds to me like it's tension or weight and having a repetitive pattern that seems to be the cause. So if someone is losing hair along their frontal hairline, it may be because you have your hair pulled back so often. And that's what you're saying, is to avoid the tension in one particular area. And if you're going to do weaves, are the same as extensions, but they're braided in. Let's just clarify that. That's correct. Okay. Because those are really popular now.
They've been popular for a while, and now I guess you're even more popular because everybody's on Instagram and everybody wants a certain look, or everybody wants to change up their look. I'm guilty of that. I want to change up my look every once in a while. I've had
I just got bangs. I got these little curtain bangs that we started easy, but I think I'm going to go shorter and get them next time. But it's kind of nice because
I just like it.
It's reducing tension, because of what you said. I felt like the same pattern every day was widening the part. And I feel like what you're saying is really going to resonate with a lot of people because you're bringing up so many different ways that this traction alopecia can present. And it's almost like we have to take a step back and wonder, okay, what are we doing repetitively that may be causing hair loss in a way we don't like? And then for the hairstylists that are listening, the habits aren't the best way. The things that you're traditionally trained to do again and again and again may not be benefiting your clients as much from what I'm hearing from you.
Exactly. And I think we all need to work together. It's about collaboration. I cannot compete with a hairstylist. And I always say it's not a competition. The hairstylist is going to style your hair and take care of it. I'm not going to do that for you.
Of
I'm not going to
course.
style your hair. I am going to tell you how to take care of your hair and scalp. And you hit that 100%, that we have to notice these patterns and stop them. And kudos to you for noticing that your part was widening, because that's the first thing, the first sign that hair is thinning or anything. And I wish that a lot of times our patients wouldn't ignore it and would actually come in and get something done about it sooner than later. And the blow drying, guess what? That's pulling. So if you're blow drying every single day, like if you work out, you wash and you blow dry every single day, we want to be careful of that, especially if it's a blow drying brush, like one of those circular brushes, or the actual comb blow drying. I know when I blow dry my hair, it's with the comb at the end of the blow dryer, and it's with a whole lot of muscle. So we want to be gentler.
So is there anything that people can do to help protect their hair when they are using these hot tools and the blow dryer? And besides limiting the frequency of how often you're going to be, using hot tools, but when you do use them, are there certain protectants that people should look for to spray in their hair or things that they should look to avoid?
Ding, 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 ding. I love it. So awesome question, because there are heat protectant sprays. So
Mhm.
there are heat protectant sprays. I've seen a couple in lotion form. Not so crazy about the ones in lotion forms, because I feel like a heat protectant spray should actually be a spray in kind of a little oil or serum form for the heat protectant sprays. I think that formulation is better. If you go to Ulta, you'll see a whole wall, or
What's the
you'll see
active?
different lines.
Do you know what the
So
active is?
it's funny because I am working on a heat
Oh,
protectant spray, and I love it. In our actives, we have some of the natural silicones, natural oils, or fatty acids that behave as silicones, and that helps create a coating on the hair. The other thing is just natural oils, jojoba oil, and things like that, because you're protecting the hair, one, but adding something that gives moisture as well, because that heat is drying. So those are two things that we look for in heat protectant sprays. Now, when I mentioned healthy silicones and fatty acids that behave as silicones, is because I'm also a big proponent of avoiding toxic chemicals in hair care products. We have so many, now we see that all our hair care products say phthalate free, paraben free, sulfate free. Well, that's because sulfate is so drying. So if we can avoid a shampoo with sulfate or something, it helps, because you dry your hair, well, then now we're increasing the risk of breakage. And the other thing is phthalates. Phthalates are so harmful. It's one of those estrogen disrupting chemicals, or EDCs, and estrogen producers. And the problem with phthalates is, Jen, they'll be in your hair care products that you use specifically for your hair. They'll be in products that are marketed to Latinx women, but they're probably 10 times higher in products marketed for women who look like me. And that is a serious problem, because what we thought were just health, hair care choices, right? Hair care product choices are creating a healthcare disparity in young Black girls and Black women.
Why is it higher?
And that is the question. Why is it higher? Is it because of what our hair requires to be styled, what our hair care requires for moisture? Because we know that silicones, like methicones, and all those things are great for textured hair and for coarse hair, and they're wonderful. But can we use some that are a little healthier? Let's avoid parabens. We all know that parabens are hormone disruptors. And so that is the question that we always wanted to address. Or is it because those products are less expensive, but that's not the case because we know that people with textured hair on average spend more on hair care products and need about 6 products just to style their hair. If you mention now a leave-in conditioner or moisturizer, an edge tamer, okay, an oil spritz, like to create sheen, you've already got 3 products there. Let's not mention the shampoo, the conditioner, and the mask after you wash your hair. So it just requires so much. And so that's why my quest has always been to work on a line and a hair care line that does good but does not harm. You know the oath we took, harmum non nocere, right? First do no harm.
First do no harm, exactly.
First do no harm. And when you look at the stats and the studies, there's a Harvard lab, and it's done a lot of research, and it's Dr. James Todd, and she showed that in a couple of studies that Black girls had breast development earlier than their counterparts or their white counterparts or even Latinx counterparts, and that they got their periods by the age of 11. And we know now that that's happened even earlier, and it's because of the hair care product. Who would have thought?
Do you think it's the hair care, or it's just a combination of everything down to the plastics that we're exposed to?
I think all of the above.
Yeah.
But
it's a
the
really
hair
big
care
problem.
itself was proven.
Yeah.
Because the phthalates were measured in the urine of Black women, and they were high. And so the phthalates, we know where they're coming from. So we know that the hair care specifically is an issue, and certain hair care products were found to be more harmful than others. So we know that's that. In addition, I'm happy you mentioned the plastics, because I speak to my patients every day about avoiding plastic. And I'm so glad so many of them come in with their stainless steel bottles. I love it.
Exactly. It's the best thing to carry everywhere. You know, it really is. Yeah, exactly. I mean, it's like you think, so I'm so glad you're bringing this up. This is great. I didn't even expect the conversation on hair to go in this direction. But I mean, when we're talking about trying to have vibrant, healthy hair, you really have to look at what kind of chemicals are coming inside your body. Your body's not going to be even producing beautiful hair, no matter what you put on it. It's not going to be making good hair if you're loaded with chemicals. So that's really, really upsetting, to say the least, about the chemicals in the products and why there's a disparity. So when people are looking, there might be a small price difference. Over the long term, it's really worth it. You look for phthalate-free, parabens-free, sulfate-free, anything else that people want to look out for when they're trying to buy the right products.
You want to avoid siloxanes, because a lot of times—
How do you spell that? Spell that for people.
S as in Sam, ILOX, N as in Nancy, E. So siloxane. And it's funny, the dimethicones always end in cones. You'll have methyl dimethicone, dimethicone, so you'll know whether they're silicones. But those siloxanes are found to be the more harmful silicones, so we want to avoid those as well. And
so you're saying dimethicone is okay, but anything with siloxane, it will say on the label siloxane. Yeah. Oh, very good.
Some dimethicones are good. So it's funny because I stay on the EWG's website, the Environmental Working Group.
It's a great website. Yeah, it's a great website.
It'll keep you busy all day. But a lot of times you can test the health of your products, skincare, hair care, body washes, everything. You can look up an ingredient and see there. Now, sometimes they're not too specific on all the ingredients, and sometimes it's not harmful, but they'll just grade it as something. So you have to understand that EWG is very, very strict on what they think is harmful or not. And also, if you look at California, that's one of the states that's really on top of things in terms of avoiding harmful ingredients. So there are some things they can't use in California that we're using on the East Coast. So that's another reference in terms of testing your hair care and beauty products. And I'm saying that not to say, I don't want to create panic. I don't want to create anything like that. But Jen, what you mentioned, those ones that we talked about, those are the ones that we really want to be aware of. And we want to stay away from siloxanes and understand that list is changing all the time as more research is done. But I agree with you, avoid the plastics when you can. Warm your food in Pyrex, warm your food in glass, not plastic Tupperware, because that's been proven to be harmful. The plastics produce estrogens. We're getting them everywhere. So wherever we can avoid it, let's just try to avoid it.
Yeah, exactly. I don't even grab the receipts at the grocery store anymore. And because
Really?
to say no, thank you. Yeah, because it's, that's how they print with the phthalates on the receipts. So I always feel bad for the workers because they're touching the receipt all day and then using hand
Yeah.
sanitizer in
Oh,
between customers, and it's helping it to penetrate. And it doesn't seem significant, but everything in this world has a compound effect. So a little bit of chemicals every day is, hundreds and hundreds of chemicals at the end of the year. 10 minutes of sun causes a lot of sun damage at the end of the year of a day. And, $3 a day of coffee adds up at the end of 10 years is a lot of more money in your bank account. So
hello.
yeah, an extra cookie a day is 10 pounds a year. So everything's a compound effect. So the more you can, minimize the exposure you have to these chemicals, I think it's really, really great. I do want to go back to the oils that you discussed though. Are there any oils, because common sense, or not common sense, but when you think about putting oil on your skin and then heat, it makes you think you're going to burn it more. Are
Yes.
there any oils that don't cause, any oils people should look for versus avoid? You mentioned jojoba oil as being nourishing and good for hair. Any other oils that are in kind of like the preferred category or the avoid category?
So, in terms of oils to avoid, I think a lot of people just a lot of times want to avoid petrolatum or anything like that because it's heavy. And then some people in general just say, look, trying to convert, crude oil to petrolatum is a nasty process. Trying to produce a silicone is a nasty process. And I just don't want that in my hair. And some people actually feel that way, and that's okay. But in terms of oils, avocado oil is great, jojoba oil is great, as we mentioned. Argan oil is wonderful. The thing is, argan oil comes from Morocco. And so a lot of times we're not getting as much argan oil
Yeah.
that we think we're getting. And so that's a nice, wonderful one for hair. I tend to steer away from olive oil. It's really heavy. I think it's really heavy on the hair. And but for some people it works. Coconut oil is amazing, but for some people they feel that it weighs their hair down. So my one thing is I always say to avoid frying your hair, because let's say you do put an oil and you're using your blow dryer or your curling iron or your flat iron and you hear a sizzle. That's so crazy about the sizzle. And and I know from experience in working on our heat protectant oil, I tried it and tried it, and I looked and I was like, oh, there's no hair on the floor because my hair was relaxed at this point. And whatever I did to it, the relaxer, it will break hair. And so my thing was, oh, is there hair on the floor? There's no hair on the floor. Or, is there smoke? And I talked to the chemist and I said, you know what? This smoke's a bit too much. And he'll say, well, let me tweak this or let me tweak that. So if so when we're talking about hair and hair care, sometimes I have walked into hair salons where it's so smoky and it's the dryer's too hot, the blow dryer is too hot, and the curling iron's too hot. And those make me nervous. And I feel like there's no amount of oil that will protect your hair from that. So,
Yeah.
so less is more, but those are the oils that are pretty good.
Okay. And you're saying it's okay to put oil on before you use the hot treatments? Because I've always thought, let's do it afterwards. But you're saying do it
Well,
before.
let's do it afterwards is I totally agree on. But when you're using a heat protectant spray, it's formulated to be able to handle that.
Got it.
So I'm saying in terms of heat protectant sprays, I
Okay.
wouldn't just put coconut oil on my hair and then just go in and flat iron it. Though you can, because the trick is with coconut oil, what you can do is put it on and then blow dry your hair. And so you have a bit of protection there. Or again, before blow drying, I do a heat protectant. You can do your leave-in conditioner or detangler and do a heat protectant because it's formulated so that it doesn't harm your hair once the heat is applied.
Okay. So the heat protectant before, but then you could add oil after.
Yes,
That's
you can
how I
add
like to.
oil
Okay.
after. And but
Okay.
here's the thing with heat protectants. If it depends on how it's formulated, it'll give you a sheen that you won't need to add
Mm.
anything afterwards. But if you have your own routine where you love this oil or this hair care product on your hair, go right ahead. Nobody's saying you can't do it. But a lot of time it already imparts a sheen.
I've lived in Washington, D.C. My hair wasn't a straw. In Arizona, your hair turns into straw.
Oh, it's so dry.
It's so dry here. So I want to your point with the olive oil, though, I love that you brought up that it can be, really heavy or inflammatory, because we know that olive oil, we see it on the skin and on the scalp. It can, uh,
Yes.
it can promote the growth of Malassezia, which is a natural yeast that we all have on our skin. And when it overgrows, it can form dandruff and kind of inflamed scaling. So it gets really confusing for people because they'll be applying olive oil and they'll start getting this dermatitis with scaling and redness, and they apply more thinking they're dry, but they're really not. It's the overgrowth of that yeast. So I tend to help people to avoid the olive oil as well. And then coconut oil can be heavy, and it could also cause breakouts along the hairline. I'm sure you've
It
seen plenty of
can.
that. Yeah.
It can. We see a lot of that. So I'm so glad that you mentioned that about the olive oil and the Malassezia furfur, because it is what people do. Oh, it's dry. Let me add more. Let me add more. But what's really interesting, when someone has a lot of flake and scale, sometimes they'll come in and say, well, I put oil on it to loosen up the flakes and get the flakes out. And I'm like, I hope you're washing it out
Yeah.
after that. And that's always my answer. I hope you're washing it out, because you don't want it on your scalp. And things about sebum on the scalp is the same thing on the face. You should be using like olive vitamin E oil and all sorts of stuff on their face, thinking their face is dry, and it's making the seborrheic dermatitis in the face worse. So
Yeah.
it's the same thing there. The thing about hair products and hair oils, like healthy hair is shiny, right? It has a certain luster to it, and we know that we want our hair to be shiny. Healthy hair is also bouncy. It moves. It's not just bogged down and weighed down and heavy. So that's why I mentioned like staying away from the coconut oils, etc. And to me, there's a difference with what you put on your scalp and what you actually put on your hair. And as derms, we tend to say the scalp is mine, the hair is yours. As long as you use some, oh, I say that, I'm sorry.
I may start saying that as well. Okay. The scalp is mine. The hair is yours. Cute. Okay.
Exactly. You put what hair care products you want to
Mm-hmm.
style your hair, as long as it's not harmful. But let me take care of your scalp. If you have sebderm, let me give you, something that you can use, a prescription. And if you're more natural and you say, well, I don't want a prescription, I want something natural, but there are naturals. But then I'm concerned about you putting tea tree oil on the scalp, because we don't know what the concentration of the tea tree oil is, from this store or that store. And I've seen patients burn themselves with tea tree oil. I love tea tree oil, antifungal, antibacterial, anti-inflammatory, but we just want to know what concentration.
Exactly. Yeah. I like it too. I like tea tree. I like rosemary. And
Yes,
what I've been
peppermint.
doing, what was that?
Peppermint oil too. It's
Oh,
anti-inflammatory. It's nice.
I haven't
Yeah.
used peppermint as much. I've done rosemary, and then I'm really into pumpkin seed oil now because of the studies
Love
showing
it.
that it blocks the 5-alpha reductase. So it's a
Yes.
5-alpha reductase inhibitor. So basically it helps with like male pattern hair loss or some female pattern hair loss as well, where you just kind of naturally, it's a genetic kind of hair loss. And I think the formula is that I use has been like 10 drops of rosemary in like what is it, an ounce of pumpkin seed. Does that sound right for you
That
as far
sounds
as
nice.
dilution? Yeah, I
It
mean,
sounds, I'm not particular on the dilutions. I don't mix them myself, but that does
mhm.
sound, I tell my patients I actually just do straight pumpkin seed oil. But that's a nice mixture of adding different anti-inflammatories together.
Because the essential oils have to be diluted for anyone listening. So they have to be diluted because they can
Yeah.
cause a high chance of getting a contact allergy to them or
Yeah.
some sort of
Yeah.
an irritation. So while they have some, I would say, medicinal benefits, they have some benefits for the skin if, or in the hair and the scalp, it can cause problems if it's not properly diluted.
Totally
Um,
agree, which is why we want to look for the ones that are safe to apply on the skin. So I'm never one, like I have a lot of essential oils, but I don't apply them to my skin. They're either aromatic or something like that. They have to be ones that are okay or safe to apply on the skin. Or you do, and then there's the mixing with the carrier oils and everything. So I do agree with you 100%. But the pumpkin seed oil, I absolutely love because of the studies as well. Now the studies were done on oral pumpkin seed oil, but a lot
mhm.
of times patients are like, I'm done. I take enough pills.
Yeah.
I don't want to take any more pills. I said, okay, then you can do topical.
Exactly. Yeah. And I mean, if they're going to use oil, why not use an oil that could be beneficial, right? So
Yeah.
what about, okay, so let's pivot a little bit. I want to respect your time because I appreciate you being here on a Saturday. So with COVID, and we've had, so when the way I was trained, let me take a step back. The way
Mhm.
I was trained, when somebody comes in with hair loss, we always ask, are you slowly gradually having your hair thin over time versus is your hair coming out in clumps, right? Like that's
Mhm.
kind of, a good starting question. So for people that are experiencing this, either having COVID or having high amounts of stress or going through, I don't know if you're seeing it with the vaccine as well, they're usually presenting with clumps of hair coming out, correct? And that we call telogen effluvium. Can you talk about that a little bit?
Correct. Okay, so gradual hair loss, as you mentioned, that's when we start thinking the female pattern hair loss, male pattern hair loss, and those hair loss in clumps is more distressing. And I think that's what actually brings patients in more than anything, because they'll show you the picture of the clumps, or they'll bring in the Ziploc bag with the clumps. See, you tell on your face,
Yes.
you totally know. Okay, so you've experienced that.
I've
And
had many gifts of bags of hair over my, over my
yes,
lifetime.
yes, totally. And so that's more distressing. So people come in sooner. And yes, I have seen it with COVID. I've seen it from just the fact that someone is quarantined and now they're anxious, and they've been taken out of their regular routine, and it's caused a lot of internal stress. And we know that stress itself will cause the hair loss. Any increase in cortisol is harmful to the human body, especially if it's constant. And I always tell my patients, I say, look, cortisol is the devil, stress is the devil. And so if you have an inflammatory hair loss and you're stressed, guess what? That's going to worsen the inflammatory hair loss with that surge of cortisol. And what we're concerned about with inflammatory hair loss is that there's scarring. So that's another thing we're concerned about. But with COVID, the anxiety that it's caused, the stress that it's caused, and not only that, but my patients who have actually had COVID, they come in with serious telogen effluvium afterwards. And so they'll come in and their hair will actually be on their clothing like long strands. And I say sometimes, oh, let's do a hair pull test or a hair tug test, where we take the hair and we pull it gently just to see how many hairs come out. And I'll get a whole handful and I'll be like, okay, so let's see how we can treat this now.
So can you just take a step back and explain, so you mentioned telogen effluvium. Can
Yes.
you just do a quick primer for the listeners on like
Sure.
anagen, catagen, telogen hairs?
Sure. Here we go, throwing out our big words, right?
Thank you.
So the hair growth cycle kind of takes 3 months to go through, which is why anytime anybody comes with hair loss and they're experiencing hair growth, we say, hey, this is not going to be overnight. It is a marathon. It is not a sprint. You got to give us 6 months before you can see some serious hair growth. It could be 3 months. It could be 6 months. Life is under promise, over deliver. So we say that it's going to take some time because you need to go through some hair cycles. Well, the hair cycle has an anagen stage, which is actively growing. It has a catagen stage, which is transitioning. And then the telogen stage, where all the hairs are kind of like resting, right? And then there's exogen, which some people think is negligible, but that's when the hair actually pops out or falls out. And you're supposed to shed every day. You're supposed to shed about, up to 100 hairs. So a day, that's normal. What you're not supposed to do is kind of clumps like Dr. Ken talked about. So most of your hairs are in the anagen stage on any given day. You can have like 70% of your hairs in the anagen stage. None of your hair is not in the same stage on your scalp. They're all at different stages. Telogen effluvium is a problem when you have a stressor, whether it be childbirth, a high fever, rapid weight loss. I see a lot of my bariatric surgery patients come in with hair loss, or somebody who went and they lost 20 pounds quickly because they tried really hard and they exercised and they went on keto or intermittent fasting, but they did it so quickly. They experience hair loss. So now that stressor has sent your hair into the resting phase. And unfortunately, most of your hairs are now in the resting phase when it should be the opposite. And then your hair starts to shed. So
and that's why they're in the resting phase. I'm sorry. They're in the resting phase. And that's why when you grab a little bit and you do a slight tug, if we do that to our scalps now, most of the hairs don't come out because they're in anagen. But if they're in the resting phase, the root is not like really firmly planted. And then you do a little tug and you get quite a few hairs coming out. And that's the telogen effluvium. Okay.
And that's the telogen effluvium. Whereas patients who are undergoing chemotherapy, they have anagen effluvium, where the hair is in the growing phase, but it's falling out because chemotherapy actually arrests, it's supposed to arrest cancer cell growth, but it arrests anything that's actively growing. So your hair is in anagen, it's actively growing, guess what? That's going to fall out too. So that's a little different.
Okay. And then how soon after the insult, whether it's surgery, pregnancy, stress, COVID, do people start noticing the hair coming out?
3 months later. Yeah, so whenever anyone says, oh, my hair is falling out, and I say, what happened 3 months ago?
Exactly. I think that's really important for everyone to hear because people will say, no, I had it 3 months ago. And that's the normal timeline that we see with this. And
Exactly.
I love, what I find to be a fun fact is like, why does our hair grow to a certain length, or why do some dogs have really long hair, right? Because they have a
Yeah.
longer anagen phase. So they have
Yeah.
a longer growing phase. So their hairs are really long. Whereas short hair dogs, their hair doesn't grow as long because it has a shorter anagen phase. But at any
Yeah.
one time, 85% of those hairs are in the anagen phase, which is why the hair is fully covered.
Yeah, and that's a good point that you bring because different people have different anagen lengths. Like your anagen phase is longer than mine. Your hair will probably go longer than mine. And when we compare, and there have been many studies comparing Caucasian hair to Asian hair to Black hair. And I say Black because it's, it could be African American, Caribbean, African, from the continent of Africa, or anything. Those anagen stages are different in all of us. And whereas I'll tell a lot of my patients who have textured hair, they say, my hair's not growing. And I say, no, everybody's hair's growing. Your hair's always growing. It's what are we doing? It's a breaking. And that's another thing. If you think that your hair is not growing, it's probably breaking. And the thing about that's interesting with textured hair or curly hair is it's like it was meant to break. It twists on itself. It breaks. And so that's the reason why we tend to add more moisture and everything. So yeah, we all have different anagen phases, and then sometimes you can take certain supplements or hair growth products, or use topical hair growth products that increase or lengthen, keep your hairs in the anagen stage for a little longer. And patients say, well, I heard that, I'll use Rogaine for example. I heard that if I start Rogaine and I stop, all my hair is going to fall out. That's not the case. The minoxidil is keeping your hair in that anagen phase. And when you stop it, guess what? It goes back to its baseline. It's not all falling out. It's just going back to what it used to do. So yeah, we love that anagen. And pregnancy keeps you in a nice anagen.
Oh, it's amazing.
phase
You have
too,
the
isn't
best
it?
hair.
Yeah,
Well,
that's the
that's why
best
when
hair.
you're done with pregnancy, you might not be having telogen effluvium. It's just that your hair is going back to where it would have been before pregnancy. So, okay, let's go. You segued perfectly into what I wanted to ask you next. So, what are some things that we can do to increase our anagen phase besides, so minoxidil, besides pregnancy, obviously, and breastfeeding? Is there any downside to using minoxidil besides the irritation? I personally used it for many years.
So downsides to using minoxidil, there's the
Besides the mess.
irritation, the mess,
Yeah.
the flakiness, the white film on the scalp, the irritation. But what I also do see is a systemic absorption. And the systemic absorption is supposed to go on your scalp and stay there, but some people absorb it in their bloodstream. And I have seen ladies with a 5 o'clock shadow or
Okay. Or low
increased.
blood pressure.
Yeah, or low blood pressure. If I have a patient who says, well, I used the Rogaine, but it made me dizzy, I say, stop immediately. You're
Yeah.
probably absorbing it systemically and it's causing the low blood pressure because minoxidil is actually a blood pressure medication. They just noticed that the gentleman in the study got hair on their chest and they said, hey, this would be great.
Don't you
And
love
that's how
that?
it
How
came
we
about.
discover these things? Like, I think
I
Viagra
love
was a heart
it.
medicine. And then they realized, men were getting beautiful erections. And, Botox was for spasms on the eye. And then
They didn't have
patients would come
wrinkles.
in and want other wrinkles to go away. And
And
then,
Lumigan,
yeah,
Lumigan, the
Latisse.
eye drops. And now it's Latisse to lengthen your eyelashes.
Right.
Everything's just great.
Yeah.
And
So,
Propecia.
uh, oh
Propecia
yeah,
was Proxcar for
it
prostate, for
it
enlarged
was,
prostate. And now we say, oh gosh, it grows hair, or it helps you
yeah.
keep your hair.
Yeah, so we're translating this for you here. So Latisse is the eyelash lengthener, and
Yeah.
it was a glaucoma medication. And what was happening is like little old men who had glaucoma in one eye were coming back with spider lashes in that eye. So then they use that obviously for lengthening eyelashes, and now it's bimatoprost. And then Proscar is finasteride 5 milligrams, which is the same as thank you. I'm blanking on the brand name of finasteride 1
Propecia.
milligram. Propecia. Thank you.
Yeah.
And it's used for benign prostatic hyperplasia, like when the prostate gets really large and men can't urinate, when they have broken streams of urine because their prostate is blocking their urethra or their ureter, correct? Yeah.
Urethra, I thought.
Urethra. Okay.
That's okay.
Sorry for my
I'm staying away from
urology
urology.
rotation.
I'm leaving it alone.
It was actually my only A+, but okay. So it was, so then men would come back and they'd have more hair. So we use these medications, to benefit other areas. And that's the same with the Rogaine. It's a blood pressure medicine, but it can help stimulate hair growth. So what Charlene is saying, basically it can stimulate hair growth on the scalp, but if you do too much or too frequently, or a lot of it's absorbed, it can kind of grow hair elsewhere, or if you dribble it on your face, it can grow hair elsewhere. So just
It
be
can
aware
grow
of
hair
that.
there. Yeah. Or if
Okay.
you get it
So,
on your pillowcase.
oh, good point. So what are some other things that can increase anagen? Like you mentioned supplements. What supplements do you like? Do you like biotin?
So I love biotin, but biotin is more to strengthen the hair because, it's a molecule that's necessary in the whole hair signaling pathway and hair growth and keratin and everything. But biotin is more, if there's a deficiency of biotin, and most people don't know they have a deficiency, they'll say, oh, let me grab this hair, skin, and nail vitamin over the counter. Well, your hair will grow because you had a deficiency. And now you've supplemented and you no longer have a deficiency, so the hair will grow. But it tends to be more of a hair strengthening thing. But my thing with biotin, I don't keep patients on it for very long. I don't do mega doses. I'm like, look, if you take 5,000 micrograms, which is 5 milligrams a day, you're fine. I wouldn't do 10. And the thing is, I take them off after 3 months because what we don't want is for it to mask any immunoassays. So some of the blood work that you get done or your doctor might require, if it's abnormal, the biotin will mask it and make it look normal, and your doctor will not know that your blood work is abnormal. So that's why we do biotin. I tend to say, let's put it on, do it for 3 months, and then stop. But biotin is awesome. If you'll notice, there are some supplements out there without,
Can I take a pause a second? I just want to take a pause a second. That is such an important point that you just brought up with the biotin. So if you're going to have blood work checked and you're taking biotin, what do you recommend people stop a week beforehand? I mean, it's water soluble. It's a B vitamin, so it's water soluble. Like how soon before they get blood testing done should they stop it so that their blood tests are not abnormal? Because there are people taking it, it's over the counter.
And they're getting blood work every day and all the time. I mean, you're on biotin, you're going to see your primary care doctor because it's in your vitamin. So I think a lot of the times it's already there, it's done. But if you know that you're going for specific blood work, I would say just to be safe, give a 2-week washout.
Okay.
And I can't really be quoted on that. It's just a recommendation. Let's just give like a little 2-week washout or something.
Yeah.
But people are doing it every day. Before that information came out, I probably done it a couple of times. Oh, great, let's get our blood drawn.
Easily.
I'm on biotin.
Yeah, easily. Yeah, I mean, that's a really, really good point. And it's not that we don't like biotin. We do like it. Just be aware, with every positive, there's a negative. Okay, so what other supplements do you like?
So other supplements that I like, well, there's stuff that I dispense out of the practice if I'm allowed to talk about it.
Of course. Yeah,
okay,
of course. We're not selling it here.
Okay, thank you. So in the practice, we dispense Viviscal, which is mostly marine based supplements, because they did this study and they realized that a group of Icelandic people had amazingly great, gorgeous, shiny, long, thick, healthy hair. And like, well, why is everybody's hair so perfect? Because their diet is full of fish and seafood and marine life that our diet here in the United States was lacking. Well, there comes Viviscal. And the only thing about Viviscal is somebody is allergic to shellfish. They can't take it because it's all, marine stuff and a little bit of shark cartilage in there. But it helps stimulate hair growth. And that's another way of giving us something that we're probably missing. Now, there's also Nutrafol that has it has like 6 ingredients to help like a total, to address the multifactorial reason for hair loss, right? And one of the ingredients in there is saw palmetto. And I remember a time, this is like way before med school, and you're an undergrad and somebody said, well, I went to GNC and got some saw palmetto and my hair is just growing. Yes, because saw palmetto also reduces dihydrotestosterone in the hair follicle, which is one of those things that make the hair follicle miniaturize or shrink and get shorter. So Nutrafol does have a little saw palmetto in there. And that was again used for the prostate.
Yeah. And it could also help for acne as well if your acne is androgen driven or testosterone driven. So
yes. So that's one of the other things that I like. And then there are a lot of people who like castor oil, and there are different variations of that. There are thicker versions, there are thinner versions. It is anti-inflammatory. It does have the nice fatty acids. I like to think of hair growth as from the inside out as well. If you think of it, your hair is anchored into your scalp, right?
Let's make sure that people understand you're talking about oral castor oil, because topically it can cause a disaster for your hair. So we're talking oral, correct?
Well, no, I'm talking topical.
Oh, you are? I've seen it get matted, really bad mats that have to be cut out.
Because then it's too oily and you're applying too much, or it might be the one of the hair of the thicker consistency.
Let's talk about what to look for and what to avoid.
So in castor oils, there's refined castor oil, there's pure castor oil. I have a Haitian background. Both of my parents are from Haiti. So I grew up with castor oil, not knowing it was castor oil. It was just, what mom rubs on her hands, makes it real hot, and then puts it on my chest when I have cold or behind my ears because it had medicinal, properties. Or if I twisted my ankles, she would warm the castor oil and massage my foot and ankle, and I'd be able to go to school the next day. So we've always used it, and some people use it on their skin. I always found it was too heavy. I found it was too heavy for hair, but there are different consistencies to it, and I think some people feel like the thicker the better. The problem with the thicker the better is that if it's too thick, anything that you're applying onto your scalp, you could plug your hair follicles and cause folliculitis, which is inflammation of the hair follicle. And again, you don't want to weigh your hair down. You don't want sticky hair. You don't want dust. I think of the summertime and New York City subways, where when the train comes and all the dust and paper and everything is flying. And if your hair is oily, it's going to feel like a catch-all for all of that. So you don't want it so weighed down and oily. But I do like the topical in some people. Again, I always say the scalp is mine, the hair is yours. You can put it on for hair moisture, as as a hair conditioner, not so often, not every day. And some people do apply it to their scalp. But my concern is always, are you clogging those follicles?
Okay. So when would you use castor oil and when would you use like jojoba oil or another oil?
That's just personal preference.
Okay.
Like I wouldn't use castor oil right before I use the curling iron or flat iron. I wouldn't do that. I probably hear and feel the sizzle.
Yeah.
But it's personal preference on how somebody likes their hair to feel.
Okay. So play around. Just play around and try.
Exactly. It's all trial and error.
That's great. Okay. Yeah. So what about like, do you use red light or low level light therapy? Do you recommend those devices ever?
I do. I actually recommend the Hair Max comb a lot.
That's what I like, the Hair Max band.
You like the band?
I like the band because you can just sort of like sit there and read and then just move it along. So
exactly.
You recommend, I guess it just depends on the person's style and how much hair they have. So, okay, talk about the science and what these these light devices are and how they work, and then how to choose which one.
Okay, lovely. So the Hair Max comb, and I'm glad you brought it up because there's so much about the different light therapies right now. They've been around for a little bit. And what they do is they use low-level laser therapy to stimulate hair growth. And here's where that comes. Let's say you wanted to get laser hair removal, right? You're going to get the laser hair removal to remove hair, let's say from your face or anything, or your armpits, whatever. Now, if somebody uses, let's use the face. If somebody uses suboptimal laser settings, like they're not using a laser setting that's strong enough to remove the hair, but they're using a smaller amount, it will actually cause a paradoxical hair growth. So instead of losing hair or getting rid of the hair, you're going to get hair. So again, how things catch on. Hey, we can grow hair with this. So here comes low-level laser therapy in the form of the Hair Max comb, Capitalist, Theradome. There are just a whole bunch of them out there. And you put it on and it stimulates hair growth. What I also love about low-level laser therapy is that it's also anti-inflammatory. So I recommend it for patients who have an inflammatory hair loss as well. But it's what wavelength. And the reason I'm a proponent of the Hair Max comb is because I remember Dr. Rox Anderson from the Wellman Labs, all the lasers, lights, everything. They did the research and they found that wavelength was actually very helpful.
What is the wavelength? It's not just 670 red light, is it?
It's not just 670 red light. And I don't think
it's a band, isn't it?
It's a band, but there was one specific band that he mentioned, and that was mentioned at a hair meeting that I went to in like 2015. So that thought evades me right now.
When we were residents and we paid attention to the nanometer length. So I was just curious.
Sweet. I was past a resident by then.
No.
So sweet.
Actually, I think I predate you. So this is interesting that you brought up the history, and I want everyone to hear because And it's just a good reflection on when something doesn't work in your life, right? If something seems like it's a mistake or an accident, like we often do in medicine, you take a step back and you say, okay, what's the significance of that? What's the meaning of that? And how can I repurpose this, right? And that's how this laser hair or this low level light therapy came to be. So I trained with Vic Ross in San Diego, and he's one of the main
Oh,
laser
yeah.
gurus, right?
Yeah.
So we had a very, very heavy laser hair removal practice because it was in the Navy. We were in the Navy in San Diego, and it's mandatory for patients to shave. And when patients of color, in particular with curly, coarse hairs, shave on the neck, it tends to become irritated and form this thing called pseudofolliculitis barbae, and it causes significant bumps and scarring on the neck. So we'd have like the whole hallway would be lined up with people getting hair removal on their neck, right? So that they can meet the standards of the military. Well, we also had residents to practice on patients. So we had a lot of wives and, children and retired people and people, all the families of the military. So we'd have a lot of Indian patients who had very, very fine hair on their cheeks, or women wanted the fine arm hair removed. And we were noticing, frustratingly so, that when we removed their hair, it wasn't responding. Just like Charlene just said, it wasn't responding. It was actually getting thicker and thicker, and the patients were getting really mad and frustrated, But the good thing is the thicker it got, the more it responded to the laser. So eventually it did kind of work for the conditions, but women don't want to deal with that on their face. So that's where this therapy came to be. We're like, okay, if we can thicken hairs by stimulating it just a little bit instead of too much to kill it, let's see, what we can do here. And that's where these caps and these combs came to be. But what I'm curious about is why you like the comb, because I actually called Hair Max about 3 days ago and asked them, like, when would you use the cap versus when would you use the comb versus when would you use the band, and like, what's your go by for that?
So for me, I tell patients the comb, but it's not that I prefer the comb. It's like, hey, you want to get something, you want to get it quickly, you get the comb. If you feel like the wand, the band is easier for you, go right ahead. But my thing is, I just try to make it accessible to everyone so that they can go out and get something. And so that's why, I say the comb, but it's just Hair Max comb, period. And I tend to like go to the website and show them, okay, this is the one that I recommend. And because there's so many out there, and a lot of them, they work, and a lot of them are personal preference for people. But again, because of that research that I had read then, that's the one that I decided to stick to. And I have patients who say, well, I don't have that. I don't have the hair comb, but I have another one. Hey, you invested in it, use it. I think that tends to be the thing, is people invest in it and put it on the shelf. And I'm like, use it. We just did some PRP. Go home and put on that low level laser modality, whichever one you have, because it actually helps even increase the amount of hair growth that you're going to get. You get PRP, you get a little light, even better. So I'm like, yeah, you invested, use it. Like they'll say, I had Rogaine and I stopped using it. Well, where's the Rogaine? I still have it. Like I bought a 3-pack. Use it.
Okay, so you just mentioned PRP. So let's talk about PRP if you have time still, because that's amazing. So what is PRP? How does it work? And when do you utilize it?
Okay, so there's PRP, platelet-rich plasma, and then you'll hear that some other companies, like I know Cellfill, they're PRFM, platelet-rich fibrin matrix. And so the matrix is the lattice and the nice interconnection and lattice of all the stem cells, the hair growth factors, and all the growth factors in there, and your scalp absorbs them all the time, which is the same thing with PRP. They did something a little different to theirs. So what we do is we draw somebody's blood, spin it down. We don't need the red blood cells. Leave the red blood cells at the bottom, and then there's that liquid gold on top. And that liquid gold is your plasma. You made it. It's yours, and it's packed with platelets, which are juicy with growth factors. So then we take that out and we inject it into the scalp. And in injecting it into the scalp, because we want to get to where the follicle is, we want to be right there. And we just inject it where there's hair loss. And then I go in and I save a little PRP on the side, because I like to microneedle after my PRP. And then since those channels are open, pour some of your remaining PRP or PRFM in there. And so I like that. And there was a study that showed that you actually got more hair growth with the microneedling process. And then I tell patients, after you're not allowed to wash your hair for 72 hours. You're not allowed to put anything constricting on your scalp for 72 hours, or to push on, on those areas, because it might feel a little lumpy after they got it done because we're depositing stuff there, but you're not allowed to manipulate it for 72 hours until your scalp has totally absorbed it, everything has settled in. And hair growth, again, it's a marathon, it's not a sprint. So some people think, well, I'm getting PRP, so my hair's going to grow right away. Well, you're going to have the best result 3 months after your last treatment. And I definitely recommend no less than 4 treatments. I have some patients who go on to 6. And then it becomes, I tell the patient, now you drive the boat, you've done it, you see some results. If you want thicker hair, we can go on so you can get even thicker hair. And I've had some ladies who have gone on to 8 treatments. No, my hair was thicker than this. It was thicker. It was thicker. And they get it to the thickness that they want it. And they're like, okay, now I'm happy.
So are you having them come, and what's your protocol? Is it once a month for 3 months and then every 6 months, or how do you typically protocol patients for the
So I do
treatment?
know that protocol, but that's not mine. My protocol.
That's why I'm asking. Yeah. Well, you're the hair guru. That's why I'm asking what your protocol is.
Yeah. Well, the one you mentioned is not a bad protocol. It's a good one, but I do every 4 weeks. So once a month for a total of 4, and then see you every 3 months.
Okay.
Or every 6 months. It depends on the patient, because some patients do not want to go 6 months without it. But my thing is, while you're away for 6 months, you're doing some sort of minoxidil, you're doing your nutraceutical, your Nutrafol, Viviscal, or whatever you're doing that, and that's still stimulating hair growth. And until you see me in 6 months. But there are some patients who won't go that long. They're like, no, I'll keep on the 3-month maintenance plan. And I'm like, okay, well then we're fine. That's okay. And there are patients who will come in because they say, oh, my hairdresser said my hair's thinning again. I'm like, well, you've been going for like 8 months. Nice to see him again. Life gets busy.
Of course.
Yeah.
So, and then when you microneedle, does it tear the hairs if someone has hair on their scalp, or what kind of device are you using, or what technique are you using? Yeah.
Very good question, because people are always afraid, oh, it's going to tear my hair or break my hair. I tend to not have that much of a problem unless somebody has really thick and long hair to begin with. And even then, I'm not worried about it, because I don't stay in any certain area for a long period of time, and I'm not mowing the lawn. I mean, it's not what we're doing. Sometimes I'll just tap around, but I still have a rotating needle. I have a pin, I have a collagen pin. And so you want to be careful not to stay in one place for too long. Some people like a stamper with multi needles.
Yeah.
I tend to like my pen, and so we're okay. My concern with somebody who has long hair is if the hairs actually get caught while it's rotating.
Like or a derma roller, or like the derma roller that people will
Oh,
try to
I
use
don't
at
do
home.
that anymore.
No, yeah, I just
I
did.
haven't done that since 2009.
No, but people are doing them at home, which is why I bring it up. And we just did, I had a video on Instagram about it with a demo doing the microneedling on me using the derma pen. So what depth are you doing with the collagen pen?
So with the collagen pin, and that's a really powerful pin, you can do a 0.5, but the question is, are you really getting down there to like the hair follicle?
Yeah.
And people, we go to the hair meeting, and as experts, we talk about it, and it's like, no, you need to go down to a 1.0 to really go down there. But here's the thing, that's in the hands of an expert. There are patients at home trying to go that deeply with their pens and rollers and however they're getting them. And I do not recommend that, because you can cause so much damage. It looks simple. It looks like it's easy and you can just do it, but there is a lot of technique to it. And honestly, the rollers, when I first started with microneedling, it was during my cosmetic surgery fellowship, and I did that with Susan Obagi in Pittsburgh. And we were like, there's this new thing people are doing elsewhere. Let's try it. And we tried what was out there at the time, the derma roller, but it wasn't as even as the pens, and you had to do it in certain directions, vertical, horizontal, diagonal, to make sure that you got everything. But then there's a pressure, the pressure is different on this side, but that side. And so I say at home, if anybody's using it, it should be much smaller. It should be shallower than what we use in the practice. And I've seen patients get other stuff. I'm like, where did you get this from? You're not supposed to be using it like that. And you can scrape, you can burn, you can When I say burn, it'll look like burn marks or track marks. You know how Fractal used to leave the little browning, the little bronzing? You can get that with microneedling, but you just want to be careful. And then we really cleanse the skin well before we do it in the practice. Yeah.
Yeah. So just it's worth your body to go to someone who knows what they're doing, because you don't want to form a permanent scar and, cause an infection because you're introducing a foreign body into your skin. That's going to just, so that's why we bring this up. So I wanted to just jump back to the nutraceuticals. How do you decide who goes on the Viviscal versus who goes on the Nutrafol? Like, are there certain times that you recommend one over the other?
Sometimes, like if somebody's coming for something in particular that tends to be like attraction alopecia around the edges or the hairline, I tend to love Viviscal for that. And then maybe a little, if it's a woman, 5% Rogaine foam, half capful. You go over half capful. Research has shown that like 60 grams will cause systemic absorption and hair growth on the face. But if you stick to 50 grams, you should be okay. So about half capful should be about 50 grams, and you do that. As long as you have no issues, that'll help. It's not to say I don't want to pigeonhole Viviscal. That's what I like it for. But in their brochure, they show you, and the studies show you that you can grow hair everywhere with Viviscal. Nutrafol, again, it addresses the multifactorial hair loss. So if it's an inflammatory hair loss, I want some Nutrafol because there's turmeric in there. And there's also ashwagandha. And we know that ashwagandha helps modify our reaction to stress. It gives you a more zen a zen feeling to everything. And a lot of my patients with hair loss, they say, yeah, the Nutrafol is great, but I need you to take extra ashwagandha because your job is very demanding. Or, you're not getting enough sleep. I need you to get some sleep too. Let's control that cortisol a little bit. Let's go for a walk. Let's listen to ocean waves, as we sleep or something like that. So I tend to do that with the inflammatory hair loss. It's not the only thing I do. Again, that's a supplement. And anyone who has like a generalized hair loss, female pattern hair loss, male pattern hair loss, or anything, I will let you know that I have a lot of patients on both. And I myself have been on both. When I experienced that traction alopecia, it was all guns ablaze. It was the Kenalog injections, the PRP. I did PRP on myself, and I took Viviscal and Nutrafol because it took that long to get my hair to grow.
On yourself. It's not a painless procedure for anyone listening. That's impressive.
No. And it's more painful when you do it to yourself.
Yeah, that's what I'm saying. I know. Oh my gosh. Okay. So what are your thoughts on collagen? Do you have any thoughts on collagen either way?
Collagen is nice. At first, when everybody was talking about, I take this collagen, I take that collagen, I was like, yeah, that's nice. But then when you think of it, really, our body degrades collagen at like 2% every single year. So it's nice to replace it, every once in a while. I know Nordic Naturals, I think it's Nordic Naturals, one of the natural companies that does a lot of stuff. They pride themselves on their collagen and how pure it is, etc. So it's not a bad thing to take so that we can supplement. And then for our skin, though, you got to use that retinoid. You got to use all that wonderful stuff that helps build collagen, and use your sunscreen because the sun degrades collagen.
Yeah. I'm just wondering, like for hair, if I haven't seen any studies on hair and collagen.
No, but I think Nutrafol put a little bit of something in the new formulation.
Oh, okay.
They may have. Yeah.
Okay.
Yeah.
Okay.
But for hair, it's not bad.
Any other, before we wrap up here, any other androgen stimulating tips that you can give that we haven't covered?
Any anagen stimulating tips? I think now that you ask, I'm blanking. I think we covered all of them.
I feel like we covered a lot. I mean, I know. Yeah, I think we covered a lot. We covered the supplements. We covered Minoxidil by the brand name Rogaine or the generic. We covered the low-level light therapy stimulation.
The finasteride. There are some lasers now where you use the laser and it just ablates a teeny little bit, and then you throw stem cells in there. So there's a lot of that going on now. And
exosomes.
That's just to stimulate. Yes, exactly.
Okay.
And you can do exosomes, but there are some with so there's exosomes and there's stem cells. Exosomes you can splash in after your PRP. So instead of saving the PRP to splash, you can use the exosomes. Exosomes, there was a whole issue on, is it medical or is it cosmetic, or are we supposed to be doing it, et cetera? But now it's been seen as a cosmetic. And it can be applied afterwards topically. We're not injecting the exosomes. We're not doing anything like that. So that's been a whole thing with exosomes.
Okay. And then would you use exosomes in older patients where maybe their platelet-rich plasma isn't as good as younger patients, or you just use it as another, another method to help stimulate hair growth in all patients?
I would use it as another method, and I would try it on anyone, because a lot of times, like if I think of cosmetic procedures, I've performed it on people who are 85, 84,
Hmm.
they just want to look better. So if it's a hair loss issue and they're finally deciding to seek help for it, we can try it as an adjuvant. I have one friend and colleague who contacted me and she was like, I just need something to improve my PRP. And that's when she started to do exosomes. Which was then I started to research and do exosomes because I tend to watch things a little more. I'm like, okay, that's nice. Out. I'm not just
Yeah,
gonna
I'm a
look at it
six-monther.
again.
I like it to kind of be
Exactly.
out for about, well, we've seen so many things come and go over the years. I mean, I've used those fillers that then are taken off the market, like 3 months later.
I
And
know.
and then you have to make phone calls and stuff. So we've just seen so many things come and go. And then look at Picato, there's just so many things that have come and gone. So it's good to be an observer. But, my understanding when I go to these conferences and they talk about exosomes and they try to get you to
Mhm.
use the exosomes, which I do use exosomes after microneedling on the face.
Nice.
It's beneficial. Is that when we have our stem cells basically, or our platelet-rich plasma as we get older, like 50, I guess is the age where they say it's not as functional typically as someone who's younger. So these exosomes come from younger sources, from placental sources where they clean it all out and they get the little messengers that stimulate growth. So it's supposed to be more even of a beneficial source. That's my understanding of it. So that's
Mhm.
why I was asking, do you just use it in older people where you're questioning if their stem cells are good anymore? Do you use it as a secondary if the PRP isn't working as well, or do you just put it on everyone? Because there is a nice, there's a pretty hefty cost to using the exosomes. It's not inexpensive.
No, and I'm still sitting here trying to decide which ones I'm going to go with. So it's funny you say that. I see it as an adjuvant, and that's how I see it. I see it as an add-on. Why
Agree.
not zhuzh up, our treatments? And my thing is with hair loss, I tend to be a little more aggressive because it's like, let's get all the hair we can while we can, especially if it's been going on for a long period of time. I feel like, oh, the hair loss.
Yeah. I mean,
Yeah.
and that's the thing. If anyone gets anything out of this episode, I mean, there's so many pearls. There's just so many pearls that Dr. Saint Surin-Lord shared here. And you can look her up. She's on Instagram at Derm Hair Doc. We'll have it in the show notes. She's based out of Washington, D.C., and she's got a very, very strong
Yeah.
practice if you want to go visit, or have a consultation with her. Are you licensed in other states to do consultations online? Do you do anything like that?
I do some telederm and consultations online. I'm licensed in DC. 'Cause I'm also on faculty at Howard University. I'm an assistant professor there, and licensed in Virginia as well. So the whole DMV area, because you can do all three in one day. So that's it
Yep.
makes sense. Yeah.
Yeah, and
Yeah.
and Maryland and stuff too. I used to live in
Yeah.
Bethesda, so yeah, it's like
See?
4 miles to every border.
Yeah,
So
4 miles to DC, 2 miles to Virginia.
exactly. Okay, very good. So we'll have all of that information in the show notes. And before we wrap, I have one more question for you that I ask all of my guests. How do you, Charlene, define radiance?
Ooh, radiance. It comes from within. Radiance comes from within. When you're glowing within and you feel good about yourself, you will do well, and it's gonna be inevitable. You can't like bottle radiance inside. If it's inside, it's inevitable that it's just gonna radiate out. And that's why I define radiance as, yes, it's how your skin looks. Does it? Because I'm looking at your skin right now. Your skin looks radiant. It's glowing. It's lovely. It's beautiful. And that's why I could tell whether my patients are using their product or not, whether they're radiant. But it's from the inside. It's what we do for our skin, how we take care of our skin. But I do believe, as with hair growth, hair loss, and everything in beauty, it starts on the inside and it radiates out. So that's what
Mm.
radiance means to me.
Thank you. Thank you so much. And I'm so incredibly grateful that you took the time to be on this episode today, because I have to say, out of all the topics, I get more questions on hair than anything else. And in over an hour, I think we're going to talk 40 minutes, but in over an hour, we covered about 2, maybe 3 different types of hair loss out of all the dozens and dozens and dozens of hair loss out there. So if you're experiencing hair loss, or alopecia is the other word, as Charlene had mentioned, alopecia just means hair loss. And then the precursor word is going to be the cause of it. You really, really want to go to a hair expert who's going to be able to aggressively treat your hair loss with the right treatments early on, because there's nothing more distressing, especially for a woman, than hair loss. I mean, no one likes acne, but hair loss will make people frantic. So I'm so glad there are people like you that are specializing in this field and sharing your knowledge. And there's so much more. There's so many more options out there nowadays for people. So thank you for your work.
Oh, thank you so much. It's my pleasure. I love what I do. I can't imagine doing anything, other than hair and derm. I just love it. And I want to say kudos to you. Kudos to you for this platform and for doing this and for reaching out to people, because I'm sure it's after people hear you and listen to you, they're like, oh, shoot, maybe I should make that appointment. It's not that bad. Let me just go do it today, or let me go do it on Monday as soon as the office is open. So thanks. Thanks
Yeah,
for having
right.
me, and thanks for doing this.
Thanks so much.
Take care.